Welcome to this presentation, where we hope to explain and demonstrate healing in such a way as it gives you the confidence to sample healing for yourself or to inquire further. First of all, let me introduce our national charity. Established in 1954, we have well over 4,000 members. Our healers and the people who come for healing hail from all faiths and none. Healing is effective no matter what your belief system may be. Qualified healer members are eligible to be listed on the NHS directory and also on our own referral register so that you can find a healer local to you. The high standards that the Healing Trust aspires to gives the public reassurance that our healers are properly trained and experienced. Our code of conduct and disciplinary procedures assures the public and healthcare professionals that our organisation and our members are committed to proper conduct. It is strictly against our code of conduct for healers to diagnose or prescribe. Although some healers prefer to work with a light touch, no physical contact is necessary for healing to take place, so it is ideal for people who are in a fragile condition. The word holistic refers to the whole person, the mind, body and emotions. Therefore, patients often report physical improvements as well as thinking more positively and feeling good. Healing works well alongside conventional healthcare and doesn't interfere with medication prescribed by your doctor. We recommend healing before an operation to help pre-op nerves and to assist recovery afterwards. Some people wonder whether healing is a placebo, but even highly skeptical people have been helped. Indeed, research shows that healing works on plants, animals, and also human tissue in petri dishes, which demonstrates that there is more than placebo at work. A healing session can be an oasis of calm in a busy world, a real stress buster to thoroughly enjoy, and many people feel energized and ready for anything afterwards.
Well, I work as a physician gastroenterologist here in this District General Hospital, and I see people who've got problems with their digestive tract, so people may have abdominal or chest pain, and also people with more general symptoms like anemia, lack of energy, weight loss. And I've been working now as a consultant since 1997. I started looking into what is involved in healing, and I was intrigued. I was conscious of no side effects, no harmful effects of this. So the way we've set up the healing service in my clinic is that patients come and see a doctor, either me or a member of my team, and we do the best we can as doctors for them in terms of investigation, reassurance, and offering recommending medication or surgery if appropriate. Many of our patients still have symptoms despite our best efforts. So in that situation, I ask patients whether they're interested in seeing the healer whose room is next door to mine, and if they are open to this, then they see the healer following seeing me. We've been fortunate in having this healing service here in my clinic now for over 2 years, and in that time more than 200 patients have had healing treatment, and the responses have been on the whole very positive, and for some people very dramatically beneficial.
The people I see have already been to see the consultant that I work with, and they come for the healing session because he's recommended it. Very often these people have never heard of healing before, or they've never had a complementary therapy session of any sort even, and sometimes they're not open-minded to the idea of healing. Yet people do still benefit. So this is just one 20-minute healing session that they have here, and the hospital audit that's on our website shows the benefits that people have experienced as a result. And as well as the graphs and the numbers that are included in that, there's also their own personal comments of how they felt about the session on the day of having it, and also their comments of how they've still experienced benefit a week later. Although there's plenty of evidence from the people I've seen here and from the thousands of people that have been seen across Britain throughout our voluntary healing groups, still there is need for research, proper research into healing. And so I'm looking forward to having that opportunity at some point.
Well, I've been working in oncology for the last 2 years as a volunteer. I've thoroughly enjoyed it, and in the time I've been there, I've been fortunate enough to have consultants and doctors observing the work that I've been doing, the healing work, and indeed they've also experienced the benefit of the healing, they've received healing. They've asked me what, as have other people, exactly what it's all about, and I try to explain to them it's rather like plugging into an electric socket. That's what I do. I plug into the socket, I am the kettle in the middle, and out comes the steam through my hands. And how do people feel? Well, they feel a tingling, sometimes they feel hot, sometimes they feel cold, usually very relaxed. And sometimes they see colours, other times they may see absolutely nothing and think that nothing's happening, although I think that healing probably is still working at a very subtle level. I've been lucky enough to have my own room in oncology and haematology, and I arrange my own appointments, which includes both patients and staff that come to me from the hospital. Often between 12 and 15 people a day come, and it's usually very busy, and it's thoroughly enjoyable for me, and I'm sure for them. That's what they say to me anyway. Generally speaking, the staff that I've seen and medical staff and doctors give me wonderful reports. Often when they're stressed and anxious, or they've had a very difficult day, they say, "Carol, can you fit me in? Can you give me half an hour sessions?" Which I do, and they feel less stressed and more energised. In fact, one doctor who was very exhausted came to me for a session after he'd had a clinic in the evening, and he said afterwards, the week after when I saw him, he'd done a dictation of 11 hours following the healing session because he'd felt so energised. Anyone working in a caring capacity, whether it be with friends or loved ones, or whether they're working in a medical professional capacity, can benefit from a course that is made available from the Healing Trust, which is a one-day course which teaches everyone how to retain their own energy so they're not depleted when working with others. In addition to that, the Healing Trust offers to medical professional people who want to go on to become full healers a specialised course so that they can actually retain and feel the benefit of the healing and pass on the good work for themselves and for others.
I was diagnosed with breast cancer in May 2000. I had a mastectomy in June and I started a radical course of chemotherapy. It was the year end at work, at school. I had an awful lot of things going on and organising, and I set off doing quite well. But then one day I seemed to hit a wall, and I recalled that I got a friend who told me she was involved with healing, and if I needed any help ever, to get in touch with her, which I saw her regularly, but I never asked her about the healing. And one morning I got up to go to work and decided I couldn't go to work, I was a mess, and I phoned her up and she was available, which was brilliant. Went straight round to her house and began a course of healing, which saved my life, I think. I sat in a chair and had some healing that first time, and felt a complete sense of relaxation. I cried, but I didn't sob, I didn't move my shoulders, I didn't cry out. My eyes just dripped water for about half an hour, and I felt so good afterwards. I did go to work. Physically, the chemotherapy started knocking me about an awful lot. I reacted very badly and spent about 2 weeks of each month then in hospital. And my friend came along and gave me healing in hospital, which proved fantastic, beneficial. It cheered me up, it made me feel better, and I could look more positively at life instead of negatively, because having cancer, everything becomes negative. You don't know. You question your future, you question your life. Your friends and family find it hard to cope, so you find yourself supporting them as much as some of them support you. But when I had the healing, I was being supported and helped, just me, and it was fantastic. After a while I still go back. Every now and again, the pressures of everyday life, you get stressed out, you don't give yourself enough time, me time, relaxation time. And I go back to the centre in Rushall, and it's like an oasis of calm. I can walk in there and I start feeling better already, and then when I've had the healing, I feel wonderful.
I became a healer after being firstly a patient at the healing centre. I'd been involved in an accident. I suffered physical injury to my knee joint. I was off work a long time. I was under pressure at work. I was quite depressed, in quite a bad way really, and I found healing helped on all levels at once. It eased the depression, it made me feel stronger inside. The pain subsided. It just gave me inner strength to cope, and I thought if I could give that to someone else, it would be a fantastic thing to do, and that's why I became a healer. When they do come to the centre, they're met by the receptionist, who will either talk them through the healing, what will happen, how we'll be working around the body, or one of the healers who might be available will talk to them. They're all privately in a side room, and they'll be then taken through for a session. Some people have a terminal condition, can get great help from healing. We've found that it can give them a great inner strength to help them cope with what lies ahead on the journey. It can ease the pain a little. It can help with the side effects of any medication they may be on. But mostly it can instill a great sense of calmness around them, which helps them to give them time to think really and cope with what lies ahead. People don't have to have any problems to come for healing. They may be feeling just a little bit down, a little bit blue, a little bit unsure of themselves. Usually these people are suffering some kind of stress, maybe emotional, even environmental, but healing can help any of those symptoms at all.
How I first heard about healing was through a colleague. I was new to my job in my school, and a colleague suggested, as I was developing services for people outside of school as well as in, she suggested that I might want to introduce healing for the staff. Schools are very frenetic and so much happens in any one day. To actually stand still at all is nigh on impossible. And so to take 10 minutes to sit down in a calm environment with other people who want to feel that calmness and re-energise for the rest of the day was marvellous. Bringing that opportunity into a school had never been done before. Certainly a colleague has said their palpitations have reduced. Another colleague has said how calm they felt and how much better they feel after a session. Certainly re-energised and ready to go back into their classroom, actually. Yeah. It was when I went back for my blood to be checked. As I say, 3 years down the line, I went to the haematology clinic and spoke to the consultant, and the consultant on that morning said to me, I'd like you to take a second blood test. And I was a bit curious about this, and I said, but I was the first person in the queue, are you sure you need to test my blood again? And I was now starting to think, uh-oh, what's going on? And the consultant said, okay, what we'll do is rerun your test from the first time rather than take another blood sample. So I waited, and he returned a few minutes later. And I was thinking, well, this is either going to be bad news or good news, and I hope he'll explain. And he said to me, we checked your blood again because your blood is normal. And I looked at him and I thought, my blood hasn't been normal for 12 years. So I said to him, what do you mean? And he said, well, your blood is the same as anybody else's, and we can't believe it, so we need to double check. And, well, I was just out through the roof, off, skipping through the clouds. I couldn't believe it.
Well, I'm Dr. John Glahome, an oncologist working in a large general hospital in Birmingham. And I first heard about the healing service from our chemotherapy nursing staff because I have allergy problems myself. And one of my colleagues suggested that Carol, one of our healers, might be able to help. And that's how it all started. And had a number of treatments lasting 20 to 30 minutes after the end of my clinic, usually very stressful days, that I found tremendously valuable. And I think the main thing is that it provided a feeling of tremendous relaxation and just a feeling of well-being afterwards that has continued actually since then, though I would like some more treatments if that's available. Certainly it's been, but it's a very good service. I've found it particularly beneficial, and I know that a lot of our patients use this service to great effect. The service is certainly at present isn't funded by the National Health Service. It's purely a voluntary service. It's provided by people who have a commitment to providing this kind of care. So we're all very grateful for that. But I think it's something that the NHS has to consider taking on board as part of a total package of care for patients with cancer, because I think the benefits are certainly significant. And I'm sure that the services as it presently stands couldn't offer treatment for everyone, but should be funded and supported so that could be expanded to allow people, all the patients effectively, to be looked after and helped in this way. Before I went for the healing, I felt quite open-minded about whether or not it would benefit. I am quite open-minded about a lot of things. I mean, it's I have a saying that if we certainly even in conventional medicine we often don't have answers to problems, full answers to problems. So you can't just dismiss something because you don't perhaps have a scientific understanding of how it might or might not work. I'd certainly recommend it to all the patients. I would like to see a completely comprehensive service available, certainly in this hospital, and I would see that it really should be something, as I said earlier, taken up by the health service in all aspects of oncology care. Given the pressures that staff are under, frontline staff in the health service, those that are actively caring for patients in clinics and wards, etc., I think the stress levels can be extremely high. The psychological burden of dealing with people who are ill is quite considerable, and this kind of service would be invaluable, absolutely invaluable.
To find a healer or healing group local to you, please contact our central office or see our website. Doctors can refer patients to a private healer, and some primary care trusts will fund the cost. Private healers charge anything from a small donation to a professional fee, but the healer will confirm this at the time of booking. Voluntary groups usually invite and welcome a minimum donation of £5 to help towards running costs. Or you might be interested in healer training and our range of continuing professional development, available throughout the country, offered by accredited tutors. Becoming a healer member gives you access to the charity's national network of support, quarterly copies of our exclusive members magazine, plus a range of other benefits. If you would simply like to support our work, your donation will be very gratefully received. For a nominal annual fee, you can register as a friend, and in exchange you receive our quarterly magazine that keeps you up to date with healing news and progress of our work. To learn more about healing and for self-help products, a range of merchandise is available from our website under Browse and Buy. Should you have any queries, we welcome you to call us.